Welcome to our comprehensive guide on hernias, specifically focusing on women. Hernias can be a common yet often misunderstood condition, affecting millions of women worldwide. In this video, we'll delve into the different types of hernias that women can experience and explore potential solutions to manage or treat them. So let's get started. Do you know millions of women worldwide are affected by hernia and most of them had little or no knowledge about it? More specifically, we will be discussing the different types of hernias in women and potential solutions to help manage or treat them. Let's get started. First, let's talk about what a hernia is. A hernia occurs when an organ, usually part of the intestine, pushes through a weak spot or opening in the surrounding muscle or tissue. While hernias are often associated with men, women can also experience them, and in fact, some types of hernias are more common in women. All right, let's break down the most common types of hernias in women and what you need to know about them. First up, the inguinal hernia. The inguinal hernia is one of the most common types, especially in women. This occurs when part of the intestine or fat pushes through the lower abdominal wall or into the inguinal canal, a passage that runs from the abdomen to the groin. While inguinal hernias are more commonly associated with men, women can also develop them, especially after pregnancy or in older age. In women, these hernias may be less noticeable, but they can still cause discomfort, especially when lifting or bending. If you experience pain, swelling, or a bulge in the groin area, it's important to consult a healthcare provider. Umbilical hernia. An umbilical hernia happens when tissue or part of the intestine pushes through the abdominal wall near the belly button. This type of hernia is quite common during pregnancy, as the abdominal muscles are stretched to accommodate the growing baby. However, it can also happen in women who are not pregnant, especially if they're overweight or have had multiple pregnancies. Typically, an umbilical hernia appears as a small bulge or swelling at the belly button, and it may become more pronounced when you cough, laugh, or lift heavy objects. Femoral hernia. Femoral hernias are less common but more likely to occur in women than men. They happen when tissue pushes through the femoral canal, located near the upper thigh or groin. This type of hernia can be more serious as it has a higher risk of strangulation, which means the blood supply to the tissue gets cut off. If you notice pain, swelling, or a bulge in the upper thigh area, particularly if it's painful or tender, make sure to seek medical advice as soon as possible. Incisional hernia. Incisional hernias can develop after abdominal surgery, when the surgical wound doesn't heal properly, leaving a weak spot in the muscle. If you've had a C-section, hysterectomy, or any other abdominal surgery, this type of hernia can occur. The tissue or intestine may push through the weakened area, creating a noticeable bulge. This type of hernia can appear months or even years after the surgery, and while some women may have no symptoms, others experience discomfort or pain. Finally, a hiatal hernia happens when part of the stomach pushes up through the diaphragm into the chest. While this type of hernia doesn't typically cause a visible bulge, it can lead to acid reflux, heartburn, and chest pain. Hiatal hernias are more common as we age and can be linked to obesity or chronic coughing. While it's less obvious than some of the other types, if you experience frequent heartburn or chest discomfort, it's important to get checked out by your doctor. Now, let's talk about solutions. If you have a hernia, treatment depends on the type and severity. But here are a few common options. First, let's discuss lifestyle changes and preventive measures. For mild cases, lifestyle changes can help manage symptoms. Maintaining a healthy weight, avoiding heavy lifting, and practicing proper posture can reduce pressure on your abdomen. For women, especially those who have had children, pelvic floor exercises like Kegels may also help prevent hernias by strengthening abdominal and pelvic muscles. If you notice any discomfort, swelling, or pain, see your doctor. They may recommend wearing a truss or binder to support the hernia. While this doesn't cure the hernia, it can alleviate symptoms temporarily. Next, let's talk about medical treatment. The most definitive solution for a hernia is surgery. Depending on the type of hernia, your doctor might recommend either open surgery or laparoscopic surgery. Both procedures aim to repair the weak spot in the abdominal wall and prevent the organ from protruding further. Though surgery is generally effective, recovery time can vary, so be sure to follow your doctor's instructions carefully and avoid strenuous activities during recovery. Whether you're dealing with an inguinal hernia, umbilical hernia, or another type, it's important to take your symptoms seriously and consult a healthcare provider for advice. Many hernias can be managed or treated effectively, so you don't have to suffer in silence. Thanks for watching today's video. If you found this information helpful, make sure to like, comment, and share it with someone who might need it. If you have any questions or personal experiences with hernias, feel free to drop them in the comments below. I'd love to hear from you. Stay healthy, and we'll see you in the next video. Remember, eSoil Tech cares about you.